it was very immediately obvious from the moment that I left my home in Naples, Florida, and hopped on an airplane to go to JFK that the world as we knew it was very different.
At Jamaica Hospital, we're a level 1 trauma center. We're used to deploying people. It's very infrequent and unusual where we're asking for help.
We had never imagined that we would deal with a crisis like this in our professional lives. So coming to work every day and seeing how many patients are coming to the ERs, how many of these patients become critically ill within days, and then seeing the number of deaths is something that is beyond our comprehension, and it's very, very difficult to deal with.
A large number of nurses at that hospital got sick. Some of them were really sick with COVID, and a couple had to be hospitalized.
It was very clear that they were completely overwhelmed with the volume, with the number of fatalities, with their inability to do what they had to do for each and every patient, with watching so many patients die and die alone.
And that's where IMC came in. It was a godsend when we called them up and said that we are handling many more patients than we're used to handling, many more critically ill patients, especially patients on ventilators.
And that's really what the name of the game has been for this specific response, is trying to get ahead of that curve and ensure that the healthcare system has the tools and the resources it needs to stay safe itself and to maintain that normal patient care standard.
I've worked response work for many, many years, since Haiti in 2010, and have been in the Congo, have been to Liberia, have been to some of the worst sudden onset disasters in history. And this was right up there with the impact that it had on our healthcare system. But it was the United States, so we're not used to this. Seeing hospital administrators, doctors and nurses, emergency room doctors in tears.
It's only in these truly global situations where all of the resources are needed at the same time, and they have pre-existing commitments, and so that's what creates an instant shortage in our world of just-in-time delivery and just-in-time ordering and supply chain movement.
Our surgeons are in the ER, our family medicine emergency physicians are on the floors taking care of patients, our cardiologists are helping out in the intensive care units, residents from across the specialties are helping wherever they can, nurses, NPs, PAs, the ancillary staff, the housekeeping people who are overwhelmed with the number of cleanings that they have to do every day.
The response that we got was just phenomenal, and they have taken such good care of our patients that I am sure that they have contributed to many lives being saved.
To have the ability to provide supplies, critical staff. The hospitals were down about 30% from staff that were either COVID positive or that were staying out because they were older or had comorbidities.
Seeing that teamwork has really given me hope. I'm really, really proud of my team.
It was humbling to be there and to be able to provide some relief to kind of the epicenter of where, in the world basically, of where the pandemic hit.